Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome to Health in Islam. I'm your host, Ismail Chartier, and with me today is Dr. Amr Mattar, professor at the Faculty of Medicine at Cairo University. Assalamu alaikum, doctor.
Assalam.
The last time you were with us, we talked about obesity, the causes of it, the effects of it, and you did an excellent job of showing us the effects and the causes of obesity. And it kind of left me with a feeling of sadness for people who are obese, knowing that all these things are affecting them and weighing on them on their daily lives. So, inshallah ta'ala, this episode will be a little more lighthearted, and we'll talk about the treatments.
Yeah.
There's always a ray of hope, inshallah ta'ala, that'll shine through the cloud that we created the last show. So, doctor, how can we treat obesity?
Well, first of all, I want to say that treatment is not the big deal.
Treatment's easy.
It's not a big deal.
Mashallah,
I know food is very beloved of everyone, and it's sometimes difficult to change your habits. But let's give this example. Before you are trained for the prayer, how hard was it?
Oh, it was really hard to learn everything, yes.
After you get used to it, you don't think when you hear that adhan, Allahu Akbar, you go and do ablution and then go for prayer without any hard effort.
Right.
Without effort. It goes that easy.
You trained yourself to do it.
What about driving? Before driving, it was very difficult. Now you can drive even talking on the phone and talk to somebody. So once you get the habit, it's easy for you. So it's easy when you have the will and you have the power to do it, inshallah. How can we treat obesity? It's a pyramid with the base of it changing your lifestyle.
Changing your lifestyle is the base.
Yes, it's not that hard. What does it mean? Changing your lifestyle. You change your eating habits together with some physical exercise. You do some exercise.
If it means going for a walk 5 minutes a day, if this is all you can handle.
5 minutes a day is not enough.
Oh, if you're like 1,000 pounds.
Let me go to this later on.
No.
This is one thing. This is the base of the pyramid. Then you go, if you need more than this, you go for drug treatment. If not enough and you're getting out of control, you can get surgery for you.
Go under the knife.
We start with the base, with the changing of the lifestyle. What about diets?
What is the principles of a good diet?
Yeah. A good diet is a balanced diet. What we mean by balanced diet? Balanced diet is a diet that contains all the food stuff we need. We need proteins, we need some of fat, we need carbohydrates, we need minerals, we need vitamins, and we need water. So we have a balanced diet, but we have to put in mind that this diet is low in calories, low in fat.
Low in calories, low in fat. I noticed I didn't hear pop on that list or soda.
Low in calories, that means you have the calories enough for you and you subtract some of them to lose weight.
So
and
if
it's
you're
not
on
a big deal.
2,000 calorie diet and you need to lose this, you only do a 1,500 calorie diet.
Yeah. Every one of us needs an amount of calorie for each kilogram of his body weight according to his bodily functions and his daily exercise. If you're a hardworking man, you need 30 calories per kilogram.
If you're like me, sedimentary.
So you need 20.
20, okay.
And in between,
20.
you need 25. So we calculate this amount. This is not for everyone to do it. This is for doctors to do it.
Yeah.
But anyway, if you have a balanced diet with calculated calories and low fat, this is a healthy diet. You reduce the fat because it's proven that fats are very harmful to the body and to the body functions and to the body system, especially your cardiovascular system. And it's not that beneficial. If you reduce the fat and get this balanced diet together with exercise, you are on the right track.
You're going down the right
Yes, you have to start this for 6 months and look what you have. If you get 5 to 10% reduction of your body weight, you are in the right track. And I want to say something here. I want to remind everybody, you don't have to go to your normal or ideal body weight. At first, on the beginning, you need to have 5 to 10% reduction of your body weight. Because even this looks minimal to some people, it's very beneficial from the health point of view. 5 to 10% reduction can let you have a good function of the cardiovascular system, can get reduction of the risk of having type 2 diabetes. It can improve your osteoarthritis if you have some. It can, in 70% of patients, can let them get rid of the sleep apnea syndrome we have spoken about. It lowers your blood cholesterol.
Just by losing 5 to 10% of your
Only
body.
5 to 10% can do so. So you don't have to jump to very hard diets and starvation and deprivation. This is not right to do. This is not the right way to do it. For the physical exercise you can do.
Slow impact on your joints.
Yes. It's economically right. It doesn't cost you to walk. This is one thing, yes.
No gym fees, yeah.
Yes. You don't have to go somewhere to do walking. You can walk around the blocks. It's very beneficial. It's no burden on the heart or cardiovascular. If you walk for 30 minutes in a speed around 3 to 5 miles an hour, you can burn up to 200 and 250 calorie. This is good.
That's very
If you cut down 500 calories a day,
and you do this,
you can get half a kilo per week, can get 2 kilograms lost of your body weight per month. That's good.
that's really good.
So we have to change our lifestyle, doing exercise and controlling our diet. I want to say something about exercise too. The best time to exercise is early in the morning or after sunset. Don't do exercise on hot weathers
When the
or
sun is
high
beaming
humid
down.
weather. Yes, this is not right. Don't start doing your exercise if you have a problem with your heart, if you have any kind of disease without,
Getting your doctor's
yes, first you have
clearance
to.
first. No. Yeah, you shouldn't be getting any
If you
exercise
get any
program without a
of these
doctor.
things I'm going to say, you stop exercise and don't do it again. If you get dizziness, get short breath, if you cannot speak while walking,
You get all
if you get blacking out, you have to stop. If you got pain in the chest or any part of your body, you stop exercising
and see your physician
and see your physician right away.
right away.
Okay.
No, that's great advice. We don't want
Get
anyone
when to not to exercise.
not to exercise. yeah.
But most of the people are not suffering with this. You go ahead for walking. There's no problem. Start with 30 minutes 3 times a week and then increase it to 5 times a week.
And 5 times a week.
And then
30 minutes a
later
day.
on, if you can increase the time, it would be better.
So you don't ever have to increase the days after 5, but if you want to go to 45 minutes
You
to
can,
an hour,
yes.
this is more benefit to you
Yeah.
than to just try to do it 7 days a week, take 2 days off for rest. Do we need, you mentioned drugs as an option. How do drugs control our weight?
Drugs used to treat obesity are different categories. There are drugs that suppresses your appetite and drugs that give you the sense of fullness. You're already not hungry, you have a full stomach. And drugs that works on your central nervous system that leads to suppression of the appetite and burning of some of the calories. We prescribe drugs to obese patients if they are, our patients have been on the moderation of the life activity for 6 months with no result.
No result whatsoever.
We can start with these 3 groups of drugs. Most of them are natural, some of them are chemicals, some of them have side effects, and the physician should decide which of which is right for that patient or that patient. It's an aid, and it can help people at some time when they need an external aid, their weight is not getting better, and their will is a little bit
It's
weak.
getting weaker.
Yeah.
So I was going to say patience is definitely a must when you're trying to lose weight. Allah
Yes.
Ta'ala says in the Quran that He is with
Yes.
the patient.
The WHO has stated that obesity is a chronic disease. We have to put in mind that obesity is a chronic disease. That means it's something you have to live with. It's like diabetes, it's like high blood pressure. Once you take the medication, you are not sick. Once you control your blood pressure, you have no problem. And it goes the same for obesity. Once you are on diet, and if you leave yourself to the bad habits again, you'll get...
Right back on the train to Fatville.
Yes.
With this, we're going to go ahead and take a quick break. My guest is Dr. Amr Mattar, professor of the Faculty of Medicine at the University of Cairo. I'm Ismail Chartier. Assalamu alaikum. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to Health in Islam. I'm still Ismail Chartier, and with me is still Dr. Amr Mattar, professor of the Faculty of Medicine at Cairo University and vice president of the Egyptian Council of Clinical Nutritional Society. Today we're talking about how to treat obesity. We talked about obesity before, now we're talking about the treatments of obesity. Doctor, I'd like to thank you for sticking through with me today because my tongue's been nothing but a big knot. So can we say that all the people who are obese are just obese because they overeat, they just want to eat all the time, or is it because there are actual physical effects of overeating, in your mind makes you overeat? Is this correct?
It is correct in a way. It's the psychological factor of treating obesity is important. Some people, when they get depressed, they go for eating.
No, we have comfort food.
Yes, they see comfort in food, in having food. Some people, on the other way around, when they are happy, they get and have a large meal. Some people eat more when they have friends around. If you look at our feasts and every celebration, we have connected every celebration
with food.
With food. Whatever the nation, whatever the religion, whatever, in every feast you have special kind of food. For Muslims, for Christians, for Jews, they go for food.
In America,
we should not do this connection. This is not right. As regards the causes, there are some diseases like the bulimia, anorexia, the compulsive and binge eating. These are diseases, they are psychological. They need psychological support as a part of the medical treatment of obesity. Not every and single one goes for eating just for fun or just. Some people have, but this is a minority, 2 to 5%. Yes, the majority go for eating from bad habits.
Just from bad habits.
I want to throw some light about the bad habits we have that leads to obesity. We haven't spoken about this. These bad habits. If you go for a large meal and you go to sleep later on, you get fat afterward. Why? What happens? You get large meal, that means you have plenty of calories in your body, and you go to sleep. What happens during sleep is that your body
goes into
basal metabolic rate goes down. The basal metabolic rate is the rate at which we are consuming energy. When you go to sleep, you don't need all that energy when you're awake. So the body cuts down the metabolic rate nearly to half. So he's not consuming energy while you're asleep.
So this is my
and already you have filled your stomach and your body with plenty of food and plenty of calories. Where do these calories go? They go for storage, being fat. So don't eat and go to sleep.
That's on my list of things I do.
Yes.
I eat a big meal, then I go, so.
You go and watch for your food. See what are you eating. You don't get plenty of fat in food. A lot of creams, a lot of ice creams, and a lot of. You have to moderate your life.
A lot of fried fatty foods.
Don't forget exercise. Don't eat while watching television, because you forget yourself. You can eat plenty of things while watching. You are not aware about what you are doing these things. One more thing that you don't have breakfast. If you don't have breakfast, this is not good for losing weight. You should have breakfast.
I do all these things that you say not to do.
You should have breakfast, because we said when you are asleep, your metabolic rate is cut down.
So
the only way to wake your body out is to have breakfast. So you should have breakfast to get your body burning more calories.
I always wondered why they picked the fattest, out-of-shape guy to host a show on health. Now I know why they're trying to save me.
So about treatment, other treatments.
Is surgery an option? I know there's like the gastral bypass and the stomach stapling. Could you explain a little bit about those? And
yes,
if there's more, talk about those.
When we go to surgery, there are certain indications. Not everyone is right for surgery. And I want to say, especially for women, don't go directly for surgery. Everyone who doesn't want to suffer doing exercise or putting himself on a diet or so and so, he goes, can you do surgery for me, please?
I'm too late. Yes. I don't want to do anything else. Can we just take to a step, further step?
We don't do surgery for everyone. Surgeries are specifically done when the patient BMI, we go back to the BMI.
The body mass index.
Over 35, together with one or more of the risk factors. The risk factors are diabetes, hypertension, coronary heart disease.
Stroke.
So these are risk factors. If they are present, together with a BMI of 35, and the moderation of the life and changing the lifestyle is not that effective, you go for surgery. Or you go directly for surgery if the BMI is over 40. Because here...
He's morbidly obese.
Yeah, he is morbidly obese. At any time, this patient is subject to have heart disease, have a cerebral stroke, have coronary, have whatever. These are serious complications. We want to save the patient from these serious complications, so we go right away to surgery.
What is the gastro bypass surgery?
There are different types of surgeries done to control obesity.
Oh, several.
Several, not only one. The bypass is one of them. But let's go for simple things. Okay. The first thing is to do a band, put a band around the stomach. The whole idea of doing surgery is to cut down the capacity of the stomach. That means...
So you get full faster.
Yeah, you get full faster with a lower amount of food. So you get full faster. How can we do this? Either we can do a band around the stomach. If you put a band around the stomach, it depends where you put this band. If you put it in the middle, so half of the stomach capacity is there. When you feel half of your, the upper half of the stomach, you get full. You stop eating. You are satisfied. So you have cut down the input of the calories to the amount you have eaten. Okay, this is one way to do it. But the band is not, it has a very good success rate up to 60%. But in 40% of patients, they go back
to doing their old way.
Yes.
They break the band.
They break the band and they go put some weight on and eat more and more food stuff. To bypass the stomach, food bypasses the stomach direct to the intestine. So some of the food is not digested. Another one is to do a bypass of part of the stomach, and then you clip the other part. So you have two things working at the same time. Small volume of the stomach and bypassing the stomach.
And the half digestion.
Yes. We can do this through surgery, not a band, by stapling part of the stomach or putting some sutures and
sewing up the person.
Sewing up the stomach. Surgery in general has some side effects, some risk factors, and some complications. The success rate is very high for surgery. 90% in most of the surgeries and only 60% for the band. Other than the band, it's 90% success, over 90% in some centers.
That's really good success.
The side effects that when you are suturing your stomach and you get the food and eat, you get some pain. While the food passing through this small channel has been done, it gives you a discomfort. So food is not pleasure anymore. And this is one thing that
changes
some
the
people
psychological aspect of the food.
And some people get more nervous when they have this operation. They lose weight, but they are not enjoying food anymore. So you have to weigh things. You want it this way or that way. And you have to take the opinion of your doctor.
And there's a hadith of Muhammad sallallahu alaihi wasallam when he was sitting with Omar and Abu Bakr, and they were eating dates.
Yeah.
And he said, this is part of the enjoyment that you will receive in this world.
Yes, this is part of the enjoyment, yes.
Because feeding is part of the enjoyment of this world.
That's right.
So when you change the psychological aspect of the food like that, where it becomes painful, does it change? Obviously, it changes the amount they eat and how much they want to eat. And does it change the way they look at food? You know, I like pizza a lot, but if it hurts, I'm not going to eat it.
You are going every time you see the pizza, you're going to go for it, but you're not going to eat that much
like, oh,
as before.
That's going to kill me.
When it gives you a pain, you will be satisfied with a small amount of the pizza.
What is your advice for someone who may be watching at home, who is obese, and they're thinking about finding and seeking treatment? What would you tell them to start with, and what would be the first step in seeking treatment?
Well, first step is that you decide to go for it. You have to have the will to go for it. The second thing to do is you seek medical advice if you are fit for things or not. Third thing is don't go for hard and difficult diet regimens to follow.
Be easy on
yourself. And put in your mind that it's not, you are not going to do this for a certain period of time. It's going to take time, and you are ready to have and pay the sacrifice for this. We start by moderation of the life, activity by using a very simple way of eating. You change your lifestyle in eating by taking simple one, like if you start with a green salad dish, a big one,
Big bowl of salad.
big bowls of salad before you start, and you follow it with the proteins, and good amounts of proteins, the proteins without fat, with low fat content on it.
Like fish.
Yes, fish or red meat or poultry without skin. And then you have your vegetables if you have. Third and fourthly, if you have some carbohydrates or starches like rice, pasta, we have bread, you can have it for. When you reach to this area having the pasta or the rice, you're not going to eat much because you already have your salad and your proteins. So you are, in a way, cutting the fat and cutting the carbohydrates without following a very strict diet. This can give you 2 to 3 kilograms per month without following a diet. In the same time, if you add to this regularly, daily exercise for 30 minutes walking, you will see wonders, inshallah.
No, subhanAllah. That's a great bit of advice, yeah, doctor. And with this, we're going to call to a close another episode with Dr. Amr Mattar, professor of medicine at Cairo University. And doctor, it's always a pleasure to have you, to see you, to listen to you. We benefit here in the studio, and inshallah at home, we benefit immensely from your knowledge of medicine, and I love having you with us. I've learned a lot about obesity and about the other episodes that you've done for us, and I appreciate your knowledge and you being here with us. Our guest, as I said, was Dr. Amr Mattar. I'm Ismail Chartier, and until next time, Assalamu alaikum.